Hello everyone, I am Dr. Mahesh Chikkachannappa, Senior Consultant Surgeon from Aster CMI Hospital, Bangalore. I am specialized in general laparoscopic, bariatric and laser proctology surgeries. Today let us talk about the commonest problem where a surgeon would see or where a man or a woman would have in the society is the abdominal wall hernias. It's very common in men as well as women. Actually, men usually develop these hernias in the groin, whereas women develop through the navel or sometimes through the previous surgical scar, which could be a C-section scar or any other surgeries which they have gone through. It is a protrusion of the abdominal contents through a weak abdominal wall or a defect in the abdominal wall. That is what we call as a hernia. It is a most commonest problem I would see in my OPD on a day-to-day basis, and most of the hernias we advise, one is the caution, as well as the best treatment advice would be a surgery that nowadays we do with the mesh repair. And with the advent of the laparoscopic as well as the robotic surgery, we can take care of these problems with a minimally invasive approach wherein there won't be a big cut as before, and we can take care of them with a much more precision with the robotics which we have as well as with the laparoscopic procedures. We usually repair these defects and provide a reinforcement with a mesh. That is what we call as a mesh repair. Whether it is a small or a big hernia, mesh is mandatory these days, at least for last 10 to 15 years. It has become a dictum to provide a mesh repair to most of the hernias. So it is like, if it's a old cloth, you try to suture that, it will tear again in the same place. But mesh, putting a new piece of cloth or putting a mesh would reinforce that area and prevents recurrences. Apart from surgeries previously, weak abdominal musculature, obesity, lifestyle also give rise to hernia issues. We have seen these days, especially with the youngsters, inadvertent lifting of heavy weights in the gym. Trying to lift heavy weights can also cause a protrusion in the groin, which is hernia, and sometimes they come with severe pains because suddenly with the jerks, a large content of the abdomen come out through the hernial orifice which can get stuck, and that is an emergency. So if you have any unexplained pain in the groin or any lump you see in the groin, it's better to see your surgeon. And also, if there is too much of pain, better not to ignore. At any age, it's better to seek advice from surgeons. And at Aster CMI, we are always available in the surgery department. Me and my team are there to take care of these problems, and we have taken care of worst of the worst hernias, the difficult hernias, sometimes the recurrent hernias, with the precision as well as with the help of our system what we have, the laparoscopic and robotics, and we can provide the best services. Please do visit us if you have the above said or the aforementioned problems and get help from us. Thank you.